War is horrible. It's not the glorious stuff you see in the old war movies. It's hard, but veterans can be changed for the better if we just get the help on the other side.
People who have moral injury are the people we want in the world. They're the people who have a conscience. They're the people who struggle with what it means to be human. Everything happens to us changes who we are. And if it's a devastating thing, a faith community is a way to hold that so you don't have to hold it all by yourself.
CBS presents Veterans Journey Home, Faith, Hope, and War. The narrator is Rollin Smith.
War changes people.
I actually don't think there's anything wrong with the veterans. That wouldn't happen to any good person who was asked to do those things and wanted to serve their country.
After the warm welcome home, many veterans find themselves asking, what next? As they create a new normal for themselves.
When I take off that uniform, I'm just a regular American. And that right there kind of tore me up. Because I built myself up as this Army Sergeant Mays, now I'm a nobody. And that right there just tore me apart.
They come home to a fairly clueless civilian population that rather than deal with the complexities of what they bring home, want to categorize them as heroes or head cases. For us to sort of think they're bad or they're evil or that we don't want to hear about it is our failure.
Since 9/11, more than 2.5 million Americans have fought in Afghanistan and Iraq.
We need to help them transition out of the war mind to the peace mind.
Roughly 22 veterans commit suicide every day. Part of the challenge is getting help to those who are least likely to ask for it.
From day one, they're saying, you can do this and you're going to fight to the end and don't show weakness. And then we get out and they tell us, go for help. We were never trained to go for help. I mean, not outside of who we're already with. We're not trained to reach out. It's a sign of weakness.
500,000 veterans come home with symptoms of post-traumatic stress disorder, or PTSD.
The enemy is no longer Taliban. It's anxiety, it's depression, it's suicidal thoughts, it's guilt, it's remorse. We're not trained to defeat those enemies. And honestly, a lot of us don't even know that the enemy's there.
Less than half seek help for their condition.
They come back home and they don't know how to reconcile that life in combat to life in America again. So they do, what comes naturally. They try to cope with it. And sometimes that's using alcohol, using drugs, or driving crazy, or getting really, really angry all the time.
For veterans with mental health and addiction problems, it often results in a run-in with the law. To stop this growing problem, veterans courts like this one in Denton County, Texas, are popping up across America.
Just based on everything that you've done and you continue to do in this court, you continue to impress us.
David Garcia is the presiding judge.
Every case that comes in, we send them to a psychologist to kind of give us an understanding of what issues a veteran has when they come into the courtroom.
Vets who agree to the terms of the court are monitored 24/7, submit to regular drug testing, and are required to have an ignition interlock device. They are also paired with a mentor who was once a combat veteran.
Any other questions?